To start, we're going to be talking about the pressure volume curve in a single cardiac cycle. Okay, you feeling good? I'm feeling good. This is what we got. Here we're going to have a pressure volume loop representing a single heartbeat. The x axis is the volume. See how I'm doing this backwards? I think I should get extra points for doing all this backwards. And y goes to the sky, and this is pressure. Ventricular pressure. The loop traces the cardiac cycle for filling, contraction, ejection, and relaxation. The ventricular filling, the volume increases while the pressure rises slightly. Kind of like that. This is the diastole. The isovolumetric contraction means that the vesicles contract and the pressure rises sharply. Like that. But the volume stays constant because the valves are closed. And the ejection phase means that the ventricular pressure exceeds the aortic pressure, and the blood is ejected, and the volume decreases. The pressure remains somewhat similar. And the pressure falls rapidly, volume remains consistent as the ventricle relaxes before the next filling phase. This is the isovolumetric relaxation. It's a box. And we can adjust these using three key factors. The preload, which is the starting volume of the ventricle. Higher preload means that it stretches the ventricle more, and you're going to have a higher SV. And then the afterload is the resistance the heart pumps against. A higher afterload means that more pressure is required to eject blood. Inotropy or the contractility is the strength the ventricle contraction is independent of preload. Higher inotropy is a steeper ejection slope and more stroke volume. SV. That's that. You feel good? I feel good. It's gone. Okay, now we're going to talk about the baroreceptor reflex. The baroreceptor reflex helps maintain stable blood pressure. Baroreceptors they sense signals. They're the stretch sensitive sensors in the carotid sinus and the aortic arch. If blood pressure rises, blood pressure's going up. Blood pressure rises, then baroreceptors send signals to the brain. That's a brain. Which to decrease heart rate and contractility, dilate the vessels and lower the pressure. If blood pressure falls, then we do the opposite. The baroreceptors send the opposite signal, and we increase heart rate, contractibility, and the vasoconstriction. This reflex acts like a rapid automatic thermostat for blood pressure. Okay. Okay, now let's talk about MAP. MAP depends on the cardiac output and the systemic vascular resistance. The MAP is equal to cardiac output times SVR. Cardiac output depends on heart rate and stroke volume. the systemic vascular resistance depends on the vesicle diameter and the blood viscosity. The baroreceptor reflex adjusts these variables to stabilize MAP. Okay, I'm just gonna keep going. There are fluids that are between capillaries and the interstitial space. They move between these places due to two main forces. Okay? HP, or hydrostatic pressure. That's a capillary. And this pushes out of the capillaries, and it's higher at the arterial end. The colloid osmotic pressure pulls fluid into the capillaries due to plasma proteins, and it's constant along the capillary. At the arterial end, the hydropressure is greater than the osmotic pressure, so you have net filtration. At the venous end, the hydrostatic pressure is less than the osmotic pressure, so you have net reabsorption. You feeling me? Okay. Now we're going to talk about edemia. Edemia occurs when there's a fluid imbalance. So the fluid balance is disrupted. For example, in heart failure, we can have the venous pressure rises and the hydrostatic pressure increases at the venous end, which causes fluid to stay in the tissues and cause swelling. In other cases, we can have low plasma proteins, which reduces osmotic pull. Or we can also have leaky capillaries that during inflammation, and that can cause swollen tissue as well. Okay, that's what I got for you. Here all night.